Good morning and welcome to The Den, where we're a source of inspiration by using our voices, knowledge, and experiences to inspire women to move with intent. In today's show, we're going to talk more about women, aging, and sexuality with our special guest again, Dr. Akinwande.
Hi, I'm Michelle, la entrenadora.
Hi, I'm Dr. Uchenna, the DR.
Hi, I'm Sherelle, the socially conscious social worker.
And I'm Dr. Evie Taylor, AKA the People's Professor, and together we are the Muse.
Well, first I'd like to say welcome again. Thank you for coming out again and sharing all of your experiences with us.
It's a pleasure to be here.
So let's dive right in. So the last show that we did, we had more questions, of course, which we thought we would. And I really specifically on like, what is this whole pelvic floor physical therapy? So I thought in the beginning, can we talk a little bit more about what you do and what women should expect when they do visit you?
Absolutely. Okay, so should I start from, what happens, I guess, when your doctor gives you a referral to come see me?
Mm-hmm. That's perfect.
So typically when women are referred to a pelvic floor physical therapist, unfortunately, it's from the perspective of kind of having too much pain or like basically not able to function. I would love to see this change in America, where women are seeking out these services just because you, obviously for women who've had a baby, if you have a baby, there are trauma to your pelvic floor muscles. So just by the design of having that event happen in your life, you should be seeking out pelvic floor physical therapy. But anyway, what typically happens is women come whenever they're having trouble with their bowel or their bladder or problems with sex. And on your first appointment, I mean, it really kind of depends on where you go. I'll say that. But for me, if you come to a person like me, which is I'm an independent practitioner and I'm considered an out-of-network provider, it's a very personalized service. And the reason why I say it's personalized is because when I eliminate insurance as the middleman, I get to focus on just what my patient needs. Typically, the first visit is between an hour and 15 minutes. And I do it in the privacy of my patients' homes. I come with all the supplies and equipment set up in a room that is convenient to them. And we talk through a patient typically. Did you have a question, Sherelle?
No, I'm just like, I didn't have that experience. Doctors call, like home calls. I love that. I'm loving that.
Yes.
Well, it's also no insurance. So that means you're kind of expensive, huh?
Yeah.
Well, I mean, it depends, right? So
Okay.
most of us, right? If you're a woman who is used to taking care of yourself and you go, let's say for a bi-monthly massage, exactly. That's exactly what I was going to say.
Okay.
It's about the cost of going for a massage, maybe a little bit more than that. And again, this is a very detailed experience. So when you get these services, you don't just get going to the doctor's office, a normal doctor's office appointment. Most people are in for 15, maybe you might be waiting for an hour or so, but your doctor spends on average 15 to 20 minutes with you maximum, right? But with this kind of an appointment, it's a full hour where you as a patient get to talk directly with me, your provider, and we get to talk about all the issues that you're having. And I look at the patient from multiple perspectives. So it's not just, hey, I'm going to give you exercises and you're going to do these things and it's going to change your symptoms. It's like, no, let's look at what are you eating every day? How are you drinking your liquids? Are you gulping things down? Are you drinking coffee every morning? Are you drinking sodas? What are the things that you are drinking and eating that are contributing to your symptoms? And then what are the lifestyle factors? And then I use that to tailor how we approach exercise and lifestyle changes.
So you said you bring all of your equipment with you. I'm very curious as to what does your equipment look like?
This is a great question.
Great question, because I was like, equipment? It's just like I was like, okay, that just.
Well, I'm not trying to be funny. I'm just being because physical therapy, when you think about physical therapy, there are always tools that are used when you go to PT.
Yes.
But I know you're very hands-on because it's the pelvic floor. So
Absolutely. I love that question. So typically what I have two big bags. One bag has a mobile bed. So that bed is on wheels, it's rolled out, it's set up in your home. And then in the second bag, we'll have everything from sheets to lube. Obviously, lube and gloves and all kinds of protective equipment for me. And then I have a couple of exercise balls. It's a number of things. I might have some lotion because sometimes I'll do manual therapy, which is kind of like massage therapy, or what people are generally familiar with calling massage therapy. I might have a cold pack, ice pack, heating pad, all these things that I use to do the therapy session. And so again, go ahead. You had a question?
Oh, no. It's really not a question. It's just, I was just thinking when I prescribe physical therapy, I'm just going to say standard physical therapy, I'm looking at maybe 2 to 3 times a week.
Mhm.
And if your schedule allots like 6 weeks.
Mhm.
So what
love
you're
it.
saying, it's already saying to me, this is a marathon, not a sprint, right? You'll be
Mhm.
visiting with these patients over how long?
So it really depends on the patient. So for what I like to say is, if you've been struggling with something, let's say you've not had control of your bowels and your bladder for 6 years, it's not going to be fixed in 3 visits, right? So a chronic issue is going to take at least 4 months to fix. That's a very bare minimum. And that is maybe considering you're highly motivated as a patient and you're doing lots of things behind the scenes to make up for all the time that was lost. Because this is such a unique type of work, and patients are generally learning a lot of new information, I won't see my patients for more than once or twice a week. Twice a week would be for the patients who just need a lot of hands-on coaching. But generally, because like I said, this is brand new information and it involves a totally different way of thinking about your health, it's a once a week visit. And this is why it's an hour long. It is tailored to the patient. No 2 people get the same program. And again, it's about what you want to achieve as a patient. What are your goals and what are we going to work towards?
You know what,
So
guys?
I would,
Oh,
no, ask, talk.
no, I just wanted to mention, coincidentally, since our last meeting, I saw like an interview that a celebrity was doing, a woman, and she was talking about this thing called a uni egg, right?
Yeah.
Do you know what that is? Okay.
I do. Yeah.
Okay, so I was listening and I heard people talk about it before, but I didn't know exactly what it was. So, I heard the little interview and then I looked it up on the internet. So there was like mixed reviews, but especially from doctors, like they weren't like really liking it for several reasons. But I was like, so that's kind of like supposedly helping with the pelvic floor thing. So maybe people that know about that might want some information, because I think that's like a trend that people are doing now.
Mm-hmm. So the simplest way to explain what a yoni egg is, if anybody,
sorry.
if anybody is like wondering what is that, right? It's like in the same way that we use dumbbells to build strength in our arms. This is like building strength in the pelvic floor. So it's a vaginal weight. So it looks like an egg and you place it into the vaginal opening. And, the idea is that you build strength by having the muscles of the pelvic floor hold the egg inside.
Yeah.
Now,
so do you recommend that stuff for your patients sometimes?
I do sometimes. It depends on the patient. And so there's all kinds of contraptions that are out now. The newest version, I guess you could say, of a yoni egg would be one that they come in different weights. So you might start off at a couple of kilograms and work up to the higher weight, just the same way you do with dumbbells. Maybe you start off at 5 pounds and 6 weeks later you're at 15, 20 pounds. It's the same kind of thing. And then some of the newer ones could get connected to your cell phone so that it can tell you when you're holding the egg correctly and when you're not.
Oh my God.
Oh, wow. That's
Yeah.
interesting.
So it gives
It's a
you,
Bluetooth.
some of them have Bluetooth features inside of them, because it for the patients who need that visual feedback and want to see how am I actually doing,
Okay.
it can give you an
Maybe.
idea.
So I'm
Okay, maybe it's
thinking-
not a bad idea. Okay.
These must
Okay.
be made from different materials, because one article I saw was talking about it being crystals and how that there were little tiny, like the surface of it could trap bacteria in there, and like those types aren't necessarily as safe.
Absolutely. And what I would say is, do not take on something like this without the direction of a pelvic floor physical therapist. Why? Because you don't know what you're doing. And if
Right.
you're just, again, if you're a patient that has a normal resting tension, vaginal weights might not be for you, because holding that even further is going to exacerbate your issues.
Mhm.
Does that make sense? So it
Yeah.
really, no matter how trendy they are, you still call a professional. And again, your OB is not going to know how to work with these vaginal weights. Your chiropractor is not going to know how to work with these vaginal weights. We are the experts. We work with this in our training as a part of our ongoing education. We know what these things are.
And
Yeah,
your
that's what I
family
was
medicine
thinking.
doctor is not going to know how to work with these vaginal weights either.
I was thinking, I'm glad that you said that you should see a PT first, because I was thinking I would not want to do that by myself, because how do I know if I'm doing it right? How do I know if I ordered the right one? You know, so if you're seeing a patient, would you just like practice the first time to show your patient?
Yeah. So typically, if I'm working with the vaginal weights, and that's something that a patient wants to use to build strength in their pelvic floor, it depends on where they start. So let's say, for example, their strength is really, really weak when they first come in. I'm going to show them how to use the vaginal weight while laying down. Why? Because if you stand up and your muscles are already weak, you're really probably not going to be able to hold the egg in. So I talk a patient through, what positions should we start in? How long are we going to keep it in? What am I doing while it's inside? And how do I remove it and wash it so that I can use it the next time? Because every time it needs to be rinsed and washed with
Mhm.
warm water, right? We don't
I
want
have
to
a
create an
question.
environment for infection.
So tell me this, for me, in practice, for my patients, because I've never sent anyone for PT physical therapy, what conditions do you recommend for me, other than I'm used to, pelvic pain, pelvic congestion syndrome? There are certain things that I'm very much so used to.
Mhm.
And I get to a point where I don't know what else to do
What's
other than
pelvic congestion?
pharmacological treatment.
So it's
Is
kind
it-
of like congestion in your chest, right? So
Yeah.
like sometimes mucus builds up in our lungs and it makes it to where it's difficult to breathe. Congestion in the pelvis is fluid building up because there's blockage in the same kind of way.
Yeah, and yeah, so our vaginas, our cells there secrete mucus. I mean, you don't really think about it, is what you're secreting, but that's what we secrete. And so that buildup causes pain, just like chest pain, like she was saying. So yeah, but it's just, you're dealing with chronic pelvic pain.
Mhm.
And I honestly, I'm so happy that we're talking to you, because I get to a point where I don't know what else to do. And I really do not like just prescribing pain medication, because that's just a superficial fix. And it doesn't, I mean, I can help with the pain with intercourse, if you will, from atrophy. Well, that just means from your vagina just kind of shriveling up, but that's another story. But I mean, just tell me, if you could give me just kind of a list of diagnoses so that I know, because I'm going to send my patients to you, because you do house calls. And like you said, even though my patients are in the underserved community, they pay money for their health. So if you're affordable for them, they will definitely, I mean, because I have a lot of women that just have a lot of pain, and we come to a crossroads and they just live with it.
Mm-hmm.
And do women have to get a referral from a doctor to see you? They can come
Love
straight.
this question. No, they don't. In the state of Texas, and again, it depends on where you live. Every state has different regulations, but in the state of Texas, if someone is a doctor of physical therapy, you don't need a referral. Now, if you need ongoing care, a doctor will have to join the care plan and sign off. But to have an initial visit, no, you don't need a referral.
New York
Okay, so let me
either.
ask this question. You don't need a referral, but depending on your insurance may require. that
She
you have
doesn't
a
take
referral.
insurance. She doesn't take.
No, I'm
insurance.
saying for her, no, but I'm just saying because some
Oh.
people will not be able to afford
makes
someone that
sense.
does private.
Right.
And so if you can't afford it and you have insurance, then you may need a referral. But like Uchenna is saying, she hasn't referred her patients. So some women, I mean, if you're watching the show and you have some of these problems, you may need to specifically ask your doctor for a referral, since that's not common practice, since most doctors aren't saying, I'm going to make this referral for you.
This is a great
And-
point. Go ahead.
No, just and on an extension, and this is personal, but can you give me? I just need some handouts from you as well, so I can have that for my patients as well.
Absolutely.
We can. Okay, good.
Absolutely. So I think, first of all, the point that Evie just brought up is great, because it is absolutely true. Like, unfortunately, like, insurance creates a lot of obstacles for patients who have insurance to try to get that care. But what patients who I have treated generally come to understand is it's worth going around the insurance and just paying directly to the provider.
Right.
And I think that as we wake up as a nation and realize we're paying for things that really don't cover what we truly need, that reckoning is what our nation needs to move healthcare coverage in a different direction. Because again, like I said, in other countries, women have babies and they're not even allowed to leave the hospital until someone like me sees them and assesses them for what's going on and helps them understand what to expect.
I would argue, honestly, policy-wise, that this is preventative. Because if we can identify, we've spoken about many things that lead to this pelvic pain and the necessity. So preventative, and that's what we're supposed to be, grounded in, right? And insurance, they pay preventative. You don't pay for preventative. So I mean, this is another, sidebar.
Policy issue that we should be talking about, because that is, that you're right, for preventive services, because it prevents a lot of issues from becoming chronic. So Uchenna's question was waiting to hear the answer for, because I'm really excited about it. So even if you could talk about it in lay terms rather than just the diagnosis, because then it also lets lay people know, like, oh, I would go to a physical therapist if this happens.
Okay.
Rather than going to a doctor who may merge them someplace else and give them some medication and they never make it to a physical therapist.
I'll say this before you say don't go to a doctor. We have to do differentials first,
Right.
Because you don't want to miss something that could be malignancy. You don't want to miss something that could be detrimental. Not to say that you don't I'm not saying at all you don't just go to a pelvic floor physical therapist. What I am saying is understand that this is a continuum, and where doctors come into play for many reasons. For me, my thought always is I need to make sure I don't miss what's going to kill my
Correct.
patients.
Good point.
I know that sounds deep and dark, but it's very true.
Nope, it's true. Because it makes a lot of sense. Very good point.
Mental health.
Yeah, because we do that with mental health. Certain things that people say, we go to the doctor first to rule out if it's something medical. Then if not, then come back. Then we'll know it's psychological. So correct.
Okay.
Thank you for making that point.
That's all. Okay.
Yeah, and I think that what both of you guys said is so key. Not only is it important for the doctor to be able to recognize when a patient needs to see someone like me, but it's also very important for a patient to be aware of and be able to be empowered enough to say, hello, doctor, even if you've never heard of this before, I need these services and this is why, right? So let me talk about a couple of things that if this is your experience, you might want to find a pelvic floor physical therapist. One, if you've ever been diagnosed with PCOS, endometriosis, any kind of issues that affect your periods, you might want to see a pelvic floor physical therapist.
PCOS as well? Okay,
Yes.
okay.
Absolutely.
Okay. Okay. I did. Okay.
PCOS is
Polycystic ovarian syndrome.
Ovarian syndrome.
thank you. Okay.
So, I mean, and again, and it's pretty similar to
That makes
endometriosis.
sense.
Yeah. So this is important because even for me, a lot of times I see, some of my clients have endometriosis, and that's causing problems like maybe in the relationships, depression, because they can't have children and things like that. So this is very useful for me because I can refer to pelvic floor PT, and that may assist with some of their pain and just understanding of things that's going on within their bodies. And with all my clients that I've had that have endometriosis, and even the people I know personally, none of them have seen a pelvic floor PT.
Wow. And
that's really impactful. So can I just ask about fibroids? Does it impact fibroids? Because many women of color have fibroids.
So
I know in my family it was very prevalent.
About fibroids, one of the things I really need to say about fibroids is it's still so widely misunderstood. There's still a lot of research that needs to be done, but absolutely pelvic floor physical therapy can help. And again, it's all about, sometimes it depends on the location of the fibroids, right?
Correct.
Sometimes surgical intervention is the only way to get it addressed. But even still, if it's impacting how frequently you're going to the bathroom, the quality of your stools, the duration of your, bowel and bladder problems or whatever, however long you're going to the bathroom, definitely go see a pelvic floor physical therapist. On that note, if you go to the bathroom or your spouse goes to the bathroom and you're spending more than 90 seconds to empty your bowels, chances are you have problems with your pelvic floor and you need to see a pelvic floor physical therapist. If you find that you're running to the bathroom more than 8 times a day, if you're the person that needs to run into the bathroom every single hour while you're awake, chances are something's wrong in your pelvic floor muscles. You need to see a therapist. There's so many things. If you have bleeding every time.
I have a question. I'm sorry. I have a question on that. Because urinary frequency that you just mentioned, that's also very much so associated with UTI, urinary tract infections. And so for those that have chronic, frequent UTIs, what I typically do is I'll prescribe prophylactic medication. But I'm hearing that these chronic UTIs should also be geared. Yes. Okay.
Yeah. Again, chronic UTIs could be symptom of again, the bladder is a muscle, right? So if that muscle is stuck in a position, there's a manual therapy technique that is widely used by pelvic floor physical therapists to kind of release the muscles around the bladder to kind of help that bladder relax and do its job. I think I've seen it time and time again when there's prophylactic medicine given to patients for UTIs. It doesn't necessarily decrease the incidence, right?
It does not. Actually leads to infection. It leads to so much more. So yeah.
So I have another question in regards to frequent urination. So I hear this a lot. I'm a big person, I push drinking a lot of water. It's really important to drink a lot of water. But I hear a lot of people say, well, I can't do that because if I drink a lot of water, I have to keep going to the bathroom. So you're saying, if you increase your water intake, is it normal to have to go to the bathroom frequently until you get used to it? Or are you saying that may be problematic because everybody should be able to?
This is a great question, right? No. Here's the thing.
It's not normal.
It's not normal. It really depends on how you're drinking the water. If you are chugging water to get your water intake instead of sipping all through the day, it's going to change how active your bladder is. So if you, right? So if my goal is I drink, your goal should be you should be drinking half of your body weight in ounces every day, right? So if you weigh 150 pounds, you should be drinking 75 ounces of water a day. But if my 75 ounces is at lunch, I drink 25, or breakfast, I drink 25, at lunch, I drink 25, and dinner, I drink 25. That means each time you chug that 25 ounces, your bladder is going to be hyperactive for about 90 minutes following your drinking. But if you just drink slowly throughout the day, 8 ounces, another 45 minutes, another 8 ounces, another 45 minutes, and another 8, try me, test me out. Test
I
out
am.
my theory.
I'm gonna do that.
It makes a big difference.
Oh.
It makes sense. It makes sense in the because you're like pushing and it just kind of reacts as opposed to it gradually. Because if you think about like even pouring, like if you spill water, right? And then when you absorb it, it's like different when it's like you can just kind of dab it from, you know,
And
when you push in the water.
On the flip side, if you're someone who just doesn't drink water at all and you decide tomorrow I'm going to drink 80 ounces of water, is it going to change how frequently you're going to the bathroom? Absolutely.
Yeah.
Right. But again, the whole idea is to train. The bladder is a muscle. You can train this muscle to be normally reactive. And the normal bladder function, you should be going to the bathroom every 2 to 3 hours.
Makes sense.
Right.
Okay, so on that note, here's my question. What if you hold your bladder, like a job like mine, where I have patient after patient after patient after patient, and I neglect my poor bladder, and I may not go to the restroom, and I have to go, and I may not go until lunch, and I get started at 8, and I may not go till 1. What am I doing to my bladder?
I love this question. So again, think about the fact that the bladder is a muscle, right? So here's the normal size of our muscle, and we pour water, right? And the bladder is kind of contracting against the water. And then we just don't release when we feel that brain signal, it just gets bigger and bigger and bigger. And so basically the bladder increases in size and becomes less useful over time. You're training your bladder to hold. And eventually what happens, we see this a lot in teachers because they have a similar setup where they're holding their bladder all day long. They get to be 40 years into teaching and then they retire and all of a sudden they lose total control of their bladder. So,
it makes sense. Makes sense. Oh my goodness.
Okay. On that note,
hold on, don't wrap up yet. Okay, so quick question. We talked a lot about like when we have problems, right? But we haven't really talked about prevention. So, of course, if your doctor, like if Uchenna refers her client or her patients, it's because there's a problem. Or people watching the show, some of the things that you talked about, they're like, oh, I have this problem. But what about like, what would we expect? Like if I say, I don't have any problems, but I want to do something preventive. Can you kind of talk a little bit as we close out, like, for somebody that wants to do this as a preventive thing, like I want to strengthen my pelvic floor because I'm hearing all of this and I think that it's important and I don't want to have problems in the future. So I come to you, what would you be able to do for me?
I love that question. What I would be able to do for you is a baseline evaluation. When I say baseline evaluation, what I would look at is the function of the pelvic floor muscles. So you get what's called an internal vaginal exam. That's when I use a little bit of lube, I put on gloves, and with this one finger, it can give me lots of information about how the muscles of your pelvic floor are functioning. On top of that, what I would do is typically run a test to see how the muscles that support the pelvic floor, meaning your glutes, your legs, your hips, I want to see how all these muscles are functioning and kind of tell you where there are areas of weakness so that you can be working on that at all times to keep your pelvic floor strong. Because here's how the thing is that the pelvic floor does not operate in isolation, right? It's connected. It's at the center of our body, right? So if you have pain or weakness in your hips or in your ankles or in your feet, it's going to eventually affect your pelvic floor. So I look at the entire picture of a person, and with the internal vaginal exam, as well as the basic functional strength test, I can tell you where you stand and how you can move forward to kind of stay at a level where you have no symptoms. And the reason why this is so key is because, believe it or not, 50% or more of the women who have, for example, a pelvic floor prolapse where her organs are sinking down into her vagina, they have no symptoms at all. So you may not feel anything, but things are happening in your body because you're not doing any work or you're using the wrong breathing patterns. And then what I hear from a lot of women in their 50s, all of a sudden, things change. Well, no, it doesn't happen that way. It's just you didn't have any symptoms, even though things were happening, and you didn't have anyone that could tell you that something is happening and you need to do something about it.
Now, how come after all these years of women getting annual exams, the doctors that are giving the exams don't know a little bit of, like, don't see a little something when they do their exams? You know what I'm saying? Like,
well, it's not that we don't see anything. It's just, so if you're having incontinence, right, you can't
no, I'm
control
talking
the
about
bladder.
like an OB.
OBGYN.
Yeah, that's not, no, I do the same thing as gynecologist, as a family medicine doctor. So what I'm saying is when I see these symptoms, I send them to specialists if I can't control it.
I'm not even saying with symptoms. I'm saying just going in there and they're looking.
Why is that a routine practice? Basically,
okay, why is what not a routine practice?
Referring to a pelvic floor exam, like right now we're having a baby, but that's what we were saying before about policy, that's not, it's not embedded in your insurances. So if it's not regarded as important because we're women, right, then it's not regarded that way.
I think that's what Uchenna talked about last time. Uchenna was saying that she has specific things that she's looking for that are essential when she's examining somebody.
But I don't think I understand the question, Michelle. Can you, you're saying why don't doctors do what now? I don't think I understand the question.
I mean, because what Valerie is saying, sometimes she'll just do like a basic exam to just see where the woman is at, right?
Well, that's what your pap smear is for. That's what your pelvic exam is for now.
Okay, why is never any information given about that?
Well, any information about what specifically? Like your what?
Pelvic floor.
Can I answer the question? It really depends on what the doctor knows. And to be honest, for a long time, this has been such a taboo topic that a lot of people don't, unless your medical school training involves you following some level of pelvic floor work or your early career involves this, they just don't get this education.
That should be included. And that's crazy.
And I think also, if I think about my practice, if you don't tell me you have any problems, and I'm thinking about that because some women don't, I ask questions when on review of systems. I ask specific questions. Do you have dysuria? Do you have incontinence? I ask all of those questions at your annual exam. And then throughout the year, I say, this is what we need to tackle throughout the year.
But Valerie is saying a lot of times you don't have symptoms, but she can see it just from the exam.
So Uchenna, let me say this. If I came to you and you asked me all those questions, I would say, no.
That's exactly.
I'm an athlete. And this is my last question, because I know we're going to have to wrap up. And so I'm used to, I'd answer all those questions. No. And I'm thinking that I'm in good health because I was an athlete my whole life. I work out every day. So I'm thinking I'm in good health. But what I've heard recently from my daughter, who's a PT student, she was told that a lot of times there's problems in athletes because you overuse certain muscles.
Yes.
And so that a lot of times athletes might have a tendency to have more issues. And so I don't know, can you speak a little bit on that? Is that true?
It is true. It absolutely is true.
Because if you're overworking the muscles in certain ways, then typical regular practice, it makes sense. But I got to say also too, and I know we're wrapping up, we keep saying that, all of us have said that, the doctor, like mine, I didn't have an issue. Right. Sometimes it's just a person's practice. And, so I said, I need a good, OBGYN, and someone gave me her name and I was like, okay. And I like her. Right. And when she said physical therapist, I was like, what for? Like and I didn't have a complaint. She just said, it's a really good idea. As you're maturing, you should probably want to go as a preventive measure just in case. Is what she said to me. And I did go for 2. And I was like feeling away, like, what is this? But, now hearing about it, reading about it more, and like interviewing with you, I'm like, I can't wait to get back in there now. Yeah. Like, I'm so like, I got to get back in there.
I'm starting to think about it.
I'm already there. I already know the person because I've been there twice already. So she didn't come to my house. I had to go to her office. That's why when you said office, I was like, oh, she's doing home visits.
Listen, when we go to Houston, we might all make appointments with you.
Yeah, we're going to come in and go, Dr. Valerie.
I'm ready. Y'all let me know. But yeah, I mean.
Yeah.
To your point, Uchenna, like, it's I love that you said that you asked those questions, but I will tell you that from my experience, when you went, but again, because I spend an hour with my patients, it is a totally different kind of experience. And most of the time, incontinence, urinary frequency, they don't know what any of that stuff means.
Well, I do explain. I actually explain what any of that means. Do you, when you cough, when you laugh? When I say frequency, there are two things. I say, do you feel like there's pressure? Do you feel like once you go to the bathroom, your bladder's not empty and you have to go again? Yes. Or when you urinate, do you feel like it's a faucet of water coming out? Right? Because those are different. Those are two different, very different things, right? Mm-hmm. So it's just what as thinking through this, mm-hmm. When you typically go see me, so family medicine doctors, right? I'm the gynecologist after I'm your gynecologist too, and I'll send you to a gyne if you need specialty work. And then if you're no longer childbearing, you don't need an OB anymore, right? So I've learned to just ask certain questions. I say that to say, but I only see you once a year for that, right?
Bingo.
And then when you come into if you're a person that doesn't go to the doctor at all, mm-hmm. maybe once a year.
Yeah.
And then when you go ahead. What are you going to say?
Remember what I said last time. The average woman who struggles with pelvic floor complaints, she waits 6 years before she tells a doctor, a friend, a family member. Why? Because we're ashamed. This is a tough conversation that has to be had.
You know what I've heard lately, and my mom said it was just normal, or my grandmother said you just have to live with it. And I've heard that a million times from my patient. Oh, well, I just thought it was normal. I just thought it's a part of getting older. Absolutely. So when you think that way, you don't even seek out help for it. Mm-hmm. Yeah. Well, any more questions before I wrap up, Blake?
Well, you better wrap up because we have more.
I know, because we got more. We keep Dr. Valerie here all day.
And close us out.
Okay. Well, all right. Well, I guess just a few directives out of this. Number one is to ask questions and ask your doctor to be sent to a pelvic floor specialist, even if you don't have any symptoms with your bladder, your bowels, your sexual intercourse, anything. Just ask to be sent at least once, so you can get an evaluation and know if there's anything that can be preventative that can be done for you, or if there's something that's being missed. And then second, just understand that as women, our bodies are complex, very complex. And even though you think it's something that you just have to deal with, you don't have to deal with it. There are so many avenues and recourses for remedies for all that's going on with us. Really, it is. So I just thank you all for joining us.
Yeah. And make sure you join us
in the den,
where places don't make you feel at home.
People do.
Bye, everybody.